Hi, welcome to today's webinar, Home Characteristics and Asthma Triggers Checklist and Training for Home Visitors, Making Homes Healthier. I'm Tracy Mitchell, Environmental Protection Specialist and Certified Asthma Educator at the U.S. Environmental Protection Agency in Washington, D.C. On behalf of EPA, we're pleased to bring you this virtual learning experience. We're so excited by the enthusiastic response we've received over today's topic. We have almost 1,500 registrants, so welcome. AsthmaCommunityNetwork.org is an online membership platform where asthma programs across the country share, learn, and connect. If you're not a member, please follow the directions here to join and access the discussion forum. AsthmaCommunityNetwork.org is also where you'll be able to access the archive of today's webinar and all of EPA's previous webinars regarding asthma. And there's several dozen there, so hopefully you'll be able to access any of our previous webinars at your convenience. I'm so pleased today to welcome my co-presenters. First, we have Ginger Chu, Deputy Associate Director of Science in the Division of Environmental Health Science and Practice at the Centers for Disease Control and Prevention. Additionally, we have Eugene Pinzer, Senior Environmental Scientist in the Office of Lead Hazard Control and Healthy Homes at the U.S. Department of Housing and Urban Development. I have had the pleasure of working with Gene and Ginger on our interagency work group, which has been collaborating for over 5 years on asthma initiatives. And while the three of us are here today to present, there have been several other individuals who've contributed specifically to this effort. I'd like to just give a shout out to Peter Ashley at HUD and to my colleagues Farani Singer and Laura Kolb from EPA for their contributions on the checklist and the training you'll hear about today. So you've seen our learning objectives. We've published them in all of our materials and marketing materials. So today we'll be discussing the history, development, and evidence base of the home assessment checklist that was developed and co-branded a couple of years ago. Our work group agreed that it is important for home visitors to understand the rationale and reasoning behind the recommended actions for each trigger. So our hope today is that by providing you this information, it will spur your interest in the checklist and in the new training materials that we've developed so that you'll use these resources in your program's home visiting. So I'd like to take a minute to talk to you about EPA's asthma program. So EPA's mission is to protect public health and the environment, and EPA's asthma program has worked for many years to ensure that environmental trigger remediation is incorporated into comprehensive asthma care. EPA supports asthma programs who are working at the state and local level, and specifically for the past several years, we've been actively supporting the delivery, infrastructure, and/or sustainable financing of environmental asthma interventions at home and school. The cogs on your screen represent EPA's 5 basic program areas. First, EPA hosts learning services to share, learn, and connect over 1,100 asthma programs through AsthmaCommunityNetwork.org. And we also continue to conduct our national media campaigns to raise awareness. We provide technical assistance through cooperative agreements and partnerships. EPA recognizes and leverages excellence through our competitive National Environmental Leadership Award in Asthma Management. We work to advance policy nationally through collaboration with the Asthma Disparities Working Group Federal Partnership and advance policy locally through regional asthma summits. And finally, we synthesize and spread learning in a variety of ways, and one example is through webinars like the one we are conducting today. I just want to take a moment. We all know the importance of local partnerships and collaboration and how important that is to achieving success in asthma care, and it's the same at the federal government level. The Asthma Disparities Working Group, the federal partnership, is one example of interagency collaboration that I mentioned. But the work on the checklist and the training is another example. So just to give you a little background, several years ago, CDC took the lead on revising an existing in-home checklist and formed this work group with EPA and HUD in order to reduce duplication of effort across the agencies and to provide an evidence-based, standardized home assessment tool. The checklist guides visitors in identifying environmental asthma triggers most commonly found in homes. After its completion, the work group determined that a training to accompany the checklist would be helpful, and that's the training you'll hear about today. It's designed for public health officials and others to train home visitors like community health workers and lay asthma educators with more information on subjects like particle size, heating, and ventilation. The training also includes sections on building and home interior, as well as providing justification and rationale for the low-cost action steps in the checklist. So as I said, we're excited to share these resources with you today. And at this time, I'd like to turn it over to my colleague, Ginger Chu from CDC.
Hi, thank you for that introduction, Tracy. I really appreciate it. So I'm going to give a little bit of the background of the checklist that was developed a couple of years ago. My work on home assessment questionnaires started in graduate school. My first paper for my doctoral dissertation was about the limitations of home characteristic questionnaires in predicting indoor allergen levels such as those from cats, cockroaches, and dust mites. At that time, I had vacuumed dust samples of homes in Boston and showed that indoor allergens were measured in homes even when residents had not reported cats or cockroaches. I thought that dust sampling and air sampling were superior ways to assess indoor allergens. However, as I progressed in my career and realized the time and cost of collecting environmental samples, much less the time and cost to analyze them in the laboratory, I changed my perception of questionnaires. Many times, those questionnaires and home inspections can be less expensive and they can provide more accurate information. Just think that when you measure secondhand smoke during the weekday and detect none, only to realize that a good questionnaire would have picked up that the family says that they have friends over on the weekends who smoke in the home. Questionnaires have been used for hundreds of years, mainly by clinicians to understand the factors that give rise to disease or illness. In the 1960s, questionnaires led to understanding that dust mites were a main component of allergy to dust. In the 1990s, several research studies measured indoor allergens by visiting homes and using questionnaires to supplement lab analysis to understand the risk factors for allergy and asthma and how to intervene to decrease those risk factors. This was followed by departments of health, community-based organizations, and health providers sending out home visitors, many of whom were community health workers. They would use those questions to assess risk factors in the home and figure out ways to decrease exposures to those with asthma. In 2010, I was glad to be part of a group of asthma researchers that pooled all of our allergen measurements together to find out the best ways, the best questions and list of answers to predict allergen levels in the homes across the United States. I recall one of the co-authors saying, "I can't believe after all of this analysis, we came up with the conclusion that having a cat predicts high cat allergen levels in the home." To which I responded, "Well, now we know the best way to ask that question in a standardized manner. Plus, we clearly know other questions that are strongly predictive of other allergens too, and how we should ask them, and what the list of possible answer choices should be." At CDC, I heard colleagues and grantees ask for a good home characteristics questionnaire for two main purposes. One, to help guide home visitors on how to help residents with asthma, and two, to collect information on asthma triggers to help focus their program's efforts. At the time, there were many home assessment checklists. However, many of them had been developed based upon specific research purposes or were very general and only touched upon a few asthma triggers. I convened a group of CDC grantees, and we came up with this list of what is important for a home assessment tool. It should be based upon evidence. It should be brief. It should be culturally appropriate, and you must have action items, or it should be referable to those that can help intervene on the home. It should be standardized. And finally, it should be flexible. The part about it being standardized is when I reached out to colleagues at EPA and HUD. We embarked on this effort, as Tracy mentioned, in 2015 with bi-weekly meetings to try to use the best scientific evidence to support questions and answers that were associated with asthma trigger exposures. This collaboration with Tracy, Jean, along with others at EPA and HUD, and my health communicators at CDC, Scott Damon and Ann Myers, was often a highlight during my week and overall of my career. The working relationship was outstanding. When we had questions used in asthma research studies, we checked to see if there was an equivalent question in the American Housing Survey. This was because that survey conducts extensive user testing to assess if questions and answers are understandable and if there is any ambiguity. When questions were not available in the American Housing Survey, we would use the questions directly or slightly modified from the scientific studies. Here are some examples of those studies. These are practice parameters of several indoor allergens. They are reviews of the strongest scientific evidence conducted by researchers with expertise in those fields. One of them, the dust mite practice parameter, had questions that were well-established risk factors for exposure. We later used a modified version of this in our home assessment checklist. Our checklist is flexible. It contains a core assessment that should be asked of all residents, and it has separate modules for dust mites and mold and moisture that can be added if those triggers are suspected by the home visitor or by the resident. Next to each question, we include a section about action steps to decrease exposure. These action steps were a carryover from a component of the original EPA checklist that a lot of people liked. We asked some initial questions about the building itself. For example, if it is a multifamily building or a house, then we ask about other features of the home. This is because some of those factors can affect not only the asthma trigger exposures, but also how you can decrease the exposures. For example, decreasing pests in a multifamily building can add a layer of complexity to any intervention you try to do compared with interventions within an individual home. Jean will talk about this later in the webinar. This is the dust mite module mentioned earlier. Not all home visitors will need to use this module. For example, areas such as Arizona are very dry and might not even have dust mites. Conversely, tropical parts of the country are very likely to have dust mites, so you can probably go directly to the action steps to try to decrease exposures. This is the mold and moisture module. This is based upon a set of questions that I published in a journal along with experts in mold and dampness in buildings. Elliot Horner, Kevin Kennedy, Charlie Barnes, Carl Grimes, and David Miller are among the authors. Once we had a draft of the core and the modules, a CDC evaluator, Sherry Brera-Disler, worked with the Departments of Health in Georgia, Maine, and Puerto Rico to understand some of the limitations of the checklist, including problems with the length and the language. Ibis Montalvo Felix, Jessica Irizarry, Christy Kuriatnik, LaShonda Lee, and Michelle Mitchell were instrumental in that evaluation. We took these comments into account, streamlined where we could, and then presented a training locally to a group of home visit staff working with the Georgia Department of Public Health. I would like to thank Christy and LaShonda for the real-life training experience. I learned a lot during that session and how the delivery of the training would work, and I fed that back to Tracy, Jean, and Sarani before we embarked upon developing the training slides. Once we finished the checklist, my CDC colleagues asked about standardized training on asthma triggers. At first, I said there are a variety of trainings available already, but then my EPA and HUD colleagues realized that having something to accompany the checklist would be really helpful to home visitors. Plus, many of the more complicated topics that we could not add to a brief checklist were often relegated to the training slides. For example, when I wanted to go into much more detail about regional differences in dust mites across the country, we would say, we'll put that in the training slides. By completing this training, we believe that home visitors will be able to, 1, understand how exposure to common asthma triggers occurs in homes, and 2, help residents find ways to identify, reduce, and remove triggers in their homes. There are over 80 slides in the slide set. We wrote a script in the notes page for each slide in the training. This way, when the slides are taught to a group of home visitors, the speaker doesn't need to search for key points in the slide. This also means that the checklist, hopefully, like the checklist, hopefully this training will also be standardized. It is our belief that this is one of the most comprehensive exposure assessment training slides available to home visit staff. We thought that rather than just talking about things like cat allergen and keep it out of the house isn't really helpful unless you truly understand why the exposure occurs in the first place. Plus, you can't intervene effectively if you don't understand what keeps those exposures going. Although not in the checklist, we knew that we had to explain the difference between allergens and irritants. This is one of those complicated concepts that we knew we couldn't cover well in a brief glossary on the front of the checklist, so we relegated it to the training slides. Particle size was another complicated concept. In the training, we knew that particle size affects exposure, and it's also important for knowing which interventions might work in a home. For example, many of the large particles associated with dust mites, cockroaches, mold, and pollen can settle out of the air quickly. However, they can also be resuspended in the air by various activities. This can happen when vacuuming, sweeping, cleaning, playing on carpeted floors, using fans, and tossing and turning in bed. Portable air cleaners will not clean the air of the large particles that are briefly resuspended, but they can remove small and medium particles that would tend to stay in the air for a long time. For example, a person with dust mite allergy would not be helped by trying to remove dust mite allergens with an air cleaner. That person might benefit more by using dust mite mattress covers to keep the large particles from being inhaled while sleeping. On the other hand, an air cleaner might help with removing small particles, such as those containing allergens from mice. Particle size also affects where the particles go in the airways, and thus how long a person is exposed to the particle. We added this section so home visitors understand particle size isn't just important for how asthma triggers exist in the home, but where they deposit in the respiratory system too. For each allergen topic, we talk about what the allergens are and the particle sizes they're on. We then give a list of possible science-based action items that are associated with decreasing exposure, symptoms, or decreasing exposure and symptoms at the same time. For pet allergen, this involved a paradigm shift. For several years, clinicians have advised keeping pets out of the bedrooms to decrease exposure to pet allergens. From the previous slides on particle sizes, it is clear that pet allergens on small particles can flow throughout the home. Plus, pet allergen can be on clothes and inadvertently carried into the bedroom. We had input from a health promotion researcher, Edith Parker, at the University of Iowa, along with health communicators at CDC, Scott and Ann, help translate the conclusion from the practice parameter on furry pets to state that it's no longer enough to do just one thing, such as keep the cat out of the bedroom. To truly decrease the exposure levels and to decrease symptoms, all four things must be done. You can do them incrementally, but eventually all must be done. Otherwise, the exposure will continue and the symptoms will continue. We figured it was time to get real with the families and let them know unless the pet is removed from the home, this is a really difficult task to decrease a continuing source of pet allergen. Many training slides will show you mold, but they don't show you things that are not mold. We put these photos in the slides to address things like algae and rust, which are not mold. We go into detail about factors that give rise to mold. We show some real-life photos of mold. Many of these were taken by me during investigations. This is a photo of mold growing on a ceiling tile. This mold growth occurred after a plumbing leak. These photos are from colleagues' homes. Some concepts, such as temperature differences leading to condensation, are best said with a photograph. We had feedback from some users about the differences in types of humidifiers. We wanted to let home visitors know that vaporizers are also humidifiers. In the checklist, we didn't have the opportunity to go into detail about the different types, so this is why it's in the training slides. We also had a question about dehumidifiers, so that's why we showed this slide. Several colleagues thought that dehumidifiers dry out the air, so they must be a risk factor for dry air. However, the reason that residents use them in the first place is because they have dampness issues in the home. So if a home visitor sees a dehumidifier in the home, this is a clue that the home is damp, and they might want to use the mold moisture module to pinpoint the factors giving rise to dampness. Dust mites are one of my favorite topics. Because they're microscopic, they're one of the most difficult asthma triggers to get rid of. You don't know if changing the sheets, vacuuming, or washing your linens has worked. So we devote quite a few slides on dust mites to explain what they are, where they're located in the US, and some regional factors that might influence how you try to decrease exposures to these microscopic arthropods. Again, we discuss the allergen exposure characteristics. Then we note that based upon scientific evidence, you don't necessarily need to wash sheets in hot water. the dust mites drown anyway. Rinse cycles and a round in the dryer will decrease the allergens. This was incorporated from the dust mite practice parameter. One of our action items is to try to keep humidity low, so we mention a hygrometer to measure humidity. This photo explains what the hygrometer is, and it was much easier than trying to type out many words to describe it. Regional differences can affect whether or not you have dust mites. So we give a few examples of different climate zones that can affect exposure. Many of the terms used to describe buildings are not familiar to those who have not lived in these different types of homes. So we shared some photos to make it a bit more clear. Now I'll turn it over to Tracy to talk more about heating and cooling systems.
Great, thank you, Ginger. Okay, so heating, ventilation, and air conditioning. Obviously, no one expects an asthma home visitor to become an HVAC expert, but we do know that indoor air quality can be affected by pollutants brought in or circulated through HVAC systems. The main purpose of this section is to remind residents to review the manufacturer's instructions in order to make sure that all HVAC systems are properly installed, inspected, adjusted, and maintained so that they operate properly and do not cause air problems. Now, they may have to call in a professional, but again, there are some simple checks that the resident can do. Regular cleaning or inspections may be required, and this can help control asthma and allergies. And the slide serves to remind the community health worker to relay to residents the importance of replacing filters and to make sure that the filter is properly fitted into the system, as you see the diagram there. Asthma management may include addressing indoor pollutants from primary sources of heating, ventilation, and cooling. But secondary heating sources might also be a concern. So we included information on a variety of heating sources that the home visitor may encounter. So you see a fireplace or space heater. And again, there could be a variety of options that a resident is using to heat their apartment or home. Another unique issue that Ginger actually brought up in this training addresses the use of air cleaners to remove asthma triggers. And so if a home visitor comes across a situation or is asked by a resident if an air cleaner is a good option for them, we point to EPA's consumer guide, which has a more technical summary about using air cleaners in the home. But again, as Ginger discussed, an air cleaner may or may not be helpful depending on the particular triggers and the particular particle size in that home. Next, I'll talk about the smoking section of the checklist and the training. I think we all know about secondhand smoke. Secondhand smoke is the smoke from the end of a cigarette, cigar, or pipe, as well as the smoke exhaled by the smoker. In this section, it helps the home visitor understand the seriousness of the problem by providing some statistics about exposure rates. And because secondhand smoke is a risk factor for new cases of asthma, especially in preschool age children, and home is the primary or main place where exposure happens, it's essential to discuss secondhand smoke during the home visit, especially if there's a smoker in the home. We know that this can be a difficult conversation, so we hoped to provide some background for the home visitor. Each year, an estimated 28 million multi-unit housing residents are exposed to secondhand smoke in their home or apartment, and that smoke comes from somewhere else in the building, such as a nearby apartment. And so you see this, we felt like this was a very powerful graphic to illustrate that point. So we know that 100% smoke-free policies are really the only effective way to fully eliminate secondhand smoke exposure. But in the meantime, a home visitor should encourage and support families with asthma to take action and not allow smoking in their home or car. Hopefully they would connect people who smoke to a smoking cessation program, such as their state quit line. And as you'll see there, HUD has a resource for starting smoke-free policies in public housing and multifamily housing. And so hopefully we added that as a resource for our home visitors. So e-cigarettes is a new and emerging area. E-cigarettes create an aerosol that can contain toxic chemicals. We know that more research is needed on the effects of secondhand aerosol. And this is definitely, as I said, an emerging area that we'll be looking to update as the research is available. But currently, the Surgeon General, CDC, and many public health advocates recommend including all tobacco products, and that includes e-cigarettes, in smoke-free rules. So we've provided that information. Now I'll turn it over to Jean Pinzer from HUD to discuss the pest and VOC section of the training.
Thank you, Tracy. If there's anyone squeamish out there, you may turn away from the screen for a while. Coronavirus, anybody hear about that? Some people benefit from the coronavirus epidemic. Some pests do anyway. There are different types of pests. The large cockroaches, the American cockroaches, are not as common as the smaller cockroaches. The German cockroaches are more common. Mouse and rat allergens are found mainly in urine, and some of the small particles can remain airborne for hours. Cockroach allergens are found mainly on fecal pellets or droppings, and larger particles settle out of the air more quickly. These things can affect pests and their allergens. Residents, change of the resident behavior, the building envelope, holes, access, leaks, availability of water, and of course, season and climate changes affect pests and allergens. Conditions around the home, obviously, leaving trash out on the street will attract pests. The other two, that's a picture of my place. Well, not really, but you can see how it would attract pests. Integrated pest management. It's a holistic approach. It approaches everything, thinking of the real life cycle and behavior of the pests. The main concepts of IPM are to make physical changes in the home, to educate residents, and to use the least possible toxic pesticides, such as gel bait versus spraying. The gel bait applications specifically for insects such as cockroaches, and using snap traps for mice and rats. Spray pesticides, bombs, and foggers are asthma triggers and ineffective. Avoid using them. Be sure to keep pesticides and traps away from children and pets. This is a roach monitor. It is not a control. I emphasize, it's used to monitor roach infestations. It is not a control procedure. Expert panels support using IPM to decrease exposure, decreases asthma symptoms and emergency department visits. In multifamily buildings, infestation from other apartments, neighboring apartments may occur. So building-wide approaches are probably necessary. And remember, IPM is an ongoing process. It's not a one-time fix. Okay, the squeamish can now turn back. Volatile organic compounds are emitted as gases or vapors from a variety of materials. Think of the smell when you're at a gas station. VOCs can be irritating and harmful to all people with asthma. Therefore, minimize the use of the product. Use products only when the person with asthma is not present, or try less irritating products. EPA provides information about the proper use and storage of pesticides. Follow manufacturer's instructions for use and storage of products with VOCs, volatile organic compounds. If you must use a product that releases VOCs, carefully follow manufacturer's instructions on the label and make sure the area is well ventilated. Never mix household care products unless so directed. Do not store open containers of unused paints, for example, and similar materials. Keep products out of reach of children and pets. And when purchasing supplies and cleaners, give preference to those that are third-party certified, such as with the Green Seal or EPA Safer Choice. I'd like to take a moment just to summarize. For pests, spraying and bombs or foggers do not work and are dangerous. The roaches have long since built up immunity to the pesticides in sprays and bombs. Keep pesticides away from children. Gel baits work and are much less harmful. And use IPM, the holistic approach, but you may have to treat an entire multifamily building. For VOCs, they're pretty much everywhere. You can often smell them, but not always. You can limit exposure by minimizing product use or choose low VOC paints, for example. Follow the manufacturer instructions for use and storage and make sure that the area is well ventilated. Use only when a person with asthma is not present or choose a different product. Thank you. That's it for me.
Yep. Thank you so much, Gene. Great information. So as we're winding down our presentation, the work group realizes that the last several months have been very challenging for asthma home visiting programs. The checklist, as we said, was developed 2 years ago, and while it was not intended to be used virtually, times have changed and home visits have changed, and we have envisioned the opportunities and occasions in which we think the materials can be used in a virtual setting. We think it's best if conducting a home visit, a virtual home visit, if you can use some sort of video chat so that the resident can show parts of the home to the home visitor while they're going through the checklist, that would be ideal. In that case, obviously, it would be helpful for the resident to have a copy, either a hard copy or an electronic copy of the checklist so that they're able to follow along with the home visitor. So this is just one example of how we've kind of brainstormed talking about using this virtually, but we'd love to hear how your program has pivoted during this time of the pandemic to conduct virtual home assessments. So I'm hoping you'll join us in the discussion forum to share your experiences. Even if you don't have a specific question, we'd love to hear your experiences. And we'd love to hear your thoughts and suggestions for incorporating this specific checklist into a virtual home visit. As a reminder, you'll see here on the screen several links where you can access the checklist. It is available in Spanish as well, and available on EPA and HUD and CDC's websites. And the checklist, that's the checklist. The training slides are currently available on EPA and CDC's website and soon to be on HUD's. So those links are provided there for you, and I encourage you all to access the checklist and the training. I'd like to thank Ginger and Jean for their great presentations and for the work over the last several years, and all of our colleagues at the agencies, CDC, EPA, and HUD, who again contributed to this work. Thank you all for your participation today. Thank you and have a great day.